So why does your jaw pop? Why do you have TMJ? To understand this, we need to do a few things. We need to understand some of the terminology and sort of backtrack to how the jaw is meant to function. So what is TMJ to start with? It's just the temporomandibular joint. It's just this bit here. Now why I say the terminology is important to understand is that the disorders of that area are actually called TMD, so temporomandibular disorders. But people often refer to TMJ as the issue. It's just the joint, which if you have that issue might be helpful if you're trying to research it on your own. But okay, let's look at how it's actually meant to function. So if you fully open your mouth, the condyles of your jaw, which is these little knobby bits that go into the joint, are meant to slide inferiorly, so down, and anteriorly, so forward. At the same time this happens, the disc, so this little thing inside the capsule of the joint, is meant to slide whenever the mandible translates, so whenever it moves like horizontally. And while we're only talking about opening the jaw, essentially all movements of the jaw require this disc involvement and the capsule to be involved. So the thing that wraps the joint, and the disc is embedded in all of that. Speaking of the capsule, it's pretty tight either side, so laterally and medially, but anteriorly and posteriorly, so front and back, it's actually pretty lax, just because it needs to allow movement to happen. The capsule is generally something that restricts. Okay, but where do things go wrong? And as far as I can tell, there are a few things here. So one is that we can just have a basic forward head posture. This is going to basically cause the mandible to be depressed and retruded. If that's your default, you're basically setting things up for incorrect mechanics, just because your natural position isn't where you're meant to start. Right, you're almost always going to have your mouth sort of open. You're going to be more of a mouth breather, which is classic in that posture. And you're going to affect some of the other structures just by being in that position. So that's one. The other is that we can have the lateral ligament get affected. So the lateral ligament prevents movement. Most ligaments do, but it prevents it in a side-to-side fashion. So if we have that get really stretched or torn for some reason, the disc, that thing again that's very important, involved in all the movements of the jaw, can move medially. Right, it's not staying where it's meant to be. And this is occurring basically because this muscle called the pterygoid, very weirdly spelt like a pterodactyl, attaches directly into the disc and the joint. Now it can pull unopposed, so it's going to pull it medially. And now we have a problem where the thing that's meant to smooth and be involved in all of these movements is now compromised. So we're going to get this really unnatural movement where it's popping and it's clicking. Speaking of the pterygoid, this really seems to be the main muscle that can be implicated in all of this, which makes sense because it's the thing attaching to the disc. So for example, the lateral pterygoid, its superior head, so its top head, again via this insertion, helps control tension and position of the disc. And if that muscle is activating excessively, it can displace the disc. So again, I think we really have our criminal here being either A, some sort of postural issue, or B, the pterygoid. Though I will say that this might just be an implicated thing, right? Why is the pterygoid tight? I don't have the answer for that yet, but it does paint the picture that it's the thing that goes wrong and it happens in concert with the lateral ligament, and perhaps things like forward posture and maybe some other issues are what set the scene for that to go wrong. Now for those of you who don't know, I've been learning all of this and more as a part of my 50 Days to Rebuild challenge, where I do 50 minutes of exercise and read 50 pages of a physio book in a day in attempts to rehab myself. What I'm discussing today has come from Newman's Kinesiology, and this is day 48. On the exercise portion of things, looking at the seated good morning, generally it felt pretty good. I had to really make sure that when my hips came back and I sort of lower into that movement, that my knees don't just extend. Like I want to keep them planted and flexed, where I was noticing that was occurring and I was sort of losing that ability to stay stable. But I was pretty well able to do this, though looking back on the video, it does look that there might be some flexion occurring in my back, so I do really need to make sure I stay neutral throughout. And then just also looking at my ankles, so something I've been working on with my calf raises and Patrick steps to really maintain a neutral foot. Again, this is actually going well. I think getting better, easier to not fatigue out. Though I did notice afterwards, I just had this sort of like desire and intuition that I really wanted to massage out my lateral foot, which is where it always gets hurt whenever I roll my ankle. It's why I end up doing a lot of this work. So overall, what got me thinking is that this work is good, but I just might need to clear essentially some scar tissue from the injuries I've had by eviscerating my foot by rolling it so much. And yeah, that is about it for day 48. Crazy to be at day 48. Thanks for watching, and I'll catch you in the next one. Cheers.